We were very interested on communicating and creating an emotional reaction among physicians as well as the lay public as it relates to addiction. We're trying to generate empathy as opposed to the stigmatized reaction that a lot of people get with drug addiction. So by being able to portray the powerful drives that get a person to take drugs when they are addicted and their suffering that goes with it, we want to generate that empathic response that will lead to caring for a person that's addicted as opposed to getting a negative reaction. There is still significant stigma on addiction among the healthcare, whether it's primary care physicians or specialized physicians. And in fact, this has been very deleterious because as a result of that, the physicians don't even screen for drug abuse or addiction. And if they know that a patient may be taking drugs, they don't even approach it.
Can you talk about the importance of screening in primary care and what role could they play to supplement what addiction specialists do?
Addiction specialists are faced with patients when they're already too advanced into the addiction. And what we want to do is to engage the primary care physicians in doing the early screening, specifically to avoid that transition into a more severe addictive state. And if there's already someone that's addicted, since most addicted people don't realize that they have a problem and don't recognize that need of treatment, also even at that level, they could play a very fundamental role in promoting and referring that particular patient for treatment. And that will help address the problem of addiction on the one hand, but also by addressing addiction, it will improve the outcomes on their medical condition because drugs adversely affect a wide variety of medical diseases.
What does it take for primary care doctors to get on this effort, and what are the barriers?
Well, the barriers had been in the past that, to start with, if a physician was screening for drugs of abuse and doing an intervention, they were not going to get reimbursed for it. So that has changed now on the one hand. Another barrier was that most individuals that are suffering from substance use disorders do not have insurance. So with healthcare reform, that is going to be changed, and the majority of patients, well, a significant number of patients, will now have the means to go to see a primary care physician. So if the primary care physician has the tools, they can then address the problem of substance use disorders.